In this video, I'm going to run through the consent process for orthodontic treatment. Although there is no legal requirement for written consent for orthodontic treatment, it is good practice to utilise a consent form to demonstrate the consent process has taken place. There are several types of consent forms for different scenarios. The white consent form 1 is for treatment on an adult. Form 2 is for treatment on a child. Form 4 is for patients who lack capacity to consent. These three consent forms are for treatments where general anaesthesia or sedation is involved. In orthodontics, the yellow number 3 consent form is used as patients, whether they are an adult or child, are agreeing to treatment where their consciousness is not impaired. If patients are undergoing other treatments, such as a general anaesthetic for expose and bond of an impacted tooth, the other consent forms may be utilised. When completing this consent form, the outer yellow sheet should be handed to the patient as it contains information regarding the consent process. This white and purple section contains guidance to health professionals about the consent process and when this consent form should be utilised. You can see here that this form is appropriate for orthodontic treatment. Everyone aged 16 or more is presumed to be competent to give consent, whilst children under the age of 16 will have a parent or an adult with parental responsibility give consent on their behalf. A child under the age of 16 who has sufficient understanding or intelligence, i.e. is Gillick competent, may be able to sign the consent form themselves. But as orthodontics is a non-urgent elective treatment, you should always involve those with parental responsibility in the consent process. There is also more information on when not to use the form, how to complete the form, and where to find more information on the law regarding consent. Before completing the consent form, ensure that a patient identifier label is placed on both the top white and green carbon copies. Next, write in the procedure to be carried out. In orthodontics, an example may be functional removable orthodontic appliance, upper and lower fixed orthodontic appliances, and removable retainers. Layman's terms such as brace is acceptable, but avoid using abbreviations such as URA, TB, ULFA and EMB. Write these out in full instead. If extractions are involved as part of the treatment, you could utilise the grid, but also supplement that with a written statement. You can also write down any other information for the patient's reference, such as the duration length for each stage of treatment, and supplement your explanation with diagrams of the types of appliances. The next section would be to talk about the intended benefits of treatment. A common benefit in orthodontics is to straighten the teeth, but other options may be to improve the appearance or improve a bite. The next section covers risks of treatment. There are many different risks, but you may wish to include decalcification, or in layman's terms, decay or permanent marks or scars on the teeth, gum disease, shortening of the roots, nerve death, relapse, pain, or failure of eruption of a tooth, as well as any other risks that are specific to the patient. At this stage, it may be useful to supplement your explanation with diagrams of decalcification or explanations of the roots and the pulp on the DPT. Once you've explained the benefits and the risks, tick this box. Orthodontic treatment usually does not involve local anaesthesia unless a TAD is being placed, so this is usually left blank along with the blood transfusion and other procedure boxes. It is always useful to supplement the explanations with leaflets, with the most common leaflets being risks of treatment, fixed appliances and retainers. Functional appliances, impacted canines and hypodontia are commonly used too. Whatever leaflets you utilise, ensure these are stated in the space below. With photography, a separate photography form is used in the department. However, it would be ideal to inform patients that photographs may be taken on a regular basis for medical records. Once you have reviewed the consent form with the patient, it can be signed. This section is signed by the clinician gaining consent, along with a date and job title such as postgraduate dentist, orthodontic registrar, senior registrar, therapist or consultant. This section is signed by an interpreter if one is present. This section is signed by the patient or the parent, providing that they agree to the procedure and understand the use of local anaesthesia where required. They must be informed that there is no guarantee that a particular person will carry out the treatment. However, it will be provided by someone with appropriate experience. The patient or person with parental responsibility can then sign the grey box. If the patient is signing, they can write self or leave this section blank. This confirmation of consent section is used when the patient has had their treatment carried out on a different day other than when the consent form was completed, and the clinician wishes to reconfirm that the patient has no further questions and is still happy to proceed. However, as the consent forms are being scanned onto the electronic salute system, completion of this section at the next appointment is not possible and thus can be left blank. Instead, the clinical note should document that the patient has no further questions and is happy to proceed with treatment. Lastly, the patient should be offered a copy of the consent form, and this section should be circled appropriately. When the form has been completed, the patient should be given the yellow and green sheets along with the appropriate leaflets. The white sheets should be handed to reception to be scanned onto Salute. The scanned consent form can be found in the patient's notes under Documents. The clinical notes should also document a summary of the treatments, that the procedure with the benefits and risks has been discussed, the leaflets that have been provided, and that consent has been gained from the patient or parent and the form has been signed. That concludes this video on the consent process in orthodontics. Thank you for watching.